Ovarian cancer is one of the most aggressive types of cancer of the female reproductive system, which is often detected in the late stages due to the non-specificity of symptoms. Early symptoms of ovarian cancer can often be mistaken for less serious conditions, for example, digestive problems or premenstrual syndrome. Therefore, ovarian cancer is often diagnosed in the late stages. Early, non-specific symptoms: bloating, flatulence, rapid satiety with food, decreased appetite, discomfort or pain in the pelvic or abdominal area, frequent urination, discomfort during urination, general weakness, fatigue, slight fever, irregular menstrual cycle, heartburn, belching, weight change, both loss and gain. Late symptoms: abdominal enlargement due to fluid accumulation, ascites, severe pain in the lower abdomen or lower back, weight loss, shortness of breath, anemia. A lumpy, dense mass in the abdomen may be palpated. In rare cases, uterine bleeding. Ovarian cancer is classified into stages depending on the extent of tumor spread. Stage 1. The tumor is limited to one or both ovaries. Stage 2. The tumor has spread to other pelvic organs. Stage 3. The tumor has spread beyond the pelvis to the peritoneum and/or regional lymph nodes. Stage 4. Distant metastases. Ovarian cancer diagnosis involves a comprehensive approach. Gynecological examination: the doctor may detect ovarian enlargement or the presence of dense masses. Pelvic ultrasound allows you to assess the size, shape, and structure of the ovaries, and to detect tumors. Doppler imaging can determine blood flow to the tumor. A blood test for tumor markers is not a specific marker for early diagnosis. It is used to monitor treatment. Computed tomography or magnetic resonance imaging allow you to get a more detailed image of the tumor, assess its spread and the presence of metastases. Positron emission tomography. Used to detect metastases, especially in the late stages. Biopsy is the gold standard for confirming the diagnosis. The obtained tissue sample is sent for histological examination. Diagnostic laparoscopy. Minimally invasive intervention that allows you to examine the abdominal organs, take a biopsy and determine the stage of the disease. There is no specific prevention of ovarian cancer, since the exact causes of its occurrence are unknown. Taking oral contraceptives. Long-term, more than 5 years, use of oral contraceptives reduces the risk of ovarian cancer. Pregnancy and breastfeeding. Every full-term pregnancy, especially before age 26, and breastfeeding, more than a year, are associated with a reduced risk. In women at high genetic risk, especially after childbearing, prophylactic removal of the ovaries and fallopian tubes may be recommended. Healthy lifestyle, a balanced diet, maintaining a normal weight, and physical activity can contribute to overall health and reduce the risk of developing many types of cancer. Regular gynecological examinations. Although they do not always allow for the detection of ovarian cancer in its early stages, regular visits to the gynecologist with pelvic ultrasound can contribute to the early detection of any changes. It is important to remember that with the appearance of any alarming symptoms, especially if they persist for several weeks, it is necessary to consult a doctor.